Now it's time to move on for On Point, which is a regular part in the show, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. As we just heard there, today, January 20th, 2022, is 2 years since the very first case of COVID-19 was confirmed in South Korea. It's an anniversary none of us particularly want to mark, but it is an anniversary nonetheless. COVID-19 cases in parts of Europe and the United States appear to be plateauing out, but in other regions the situation is actually getting much worse. Certain US states are reporting fewer hospitalizations and cases, but the picture is quite different in other states.
Parts of Europe are still reporting record levels of infections, and hardline restrictions put in place in countries like France, Germany, and the Netherlands have been met by large protests. In Asia, citing the current situation, the IOC now says only invited spectators who strictly abide by COVID-19 protocols will be allowed to attend the Beijing Winter Olympics. For more at where we stand globally in regards to the pandemic, we are joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor.
Good morning.
So, Professor, how the governments vaccinate their citizens have become a heated debate. So the so-called vaccine passes have also been proven controversial, not only in Europe, but also here in South Korea. So what is your view on the need and the efficiency of these vaccine passes?
Well, in some places, there's a lot of enthusiasm among the population to get vaccinated, and that's great. In other places, maybe some people do want to get vaccinated, other people don't. And the government wants to find ways to get the vaccine coverage to a higher and higher level, because we know that's going to make the impact of COVID less and less, the higher the vaccine coverage is. So there's incentives, and there's also disincentives against vaccination or to get vaccinated. The World Health Organization has said that they think vaccine passports should be the last resort, the measure of last resort. Before going to passports, think about other ways to encourage people to choose to get vaccinated. Myself personally, I'm not a big fan of vaccine passports, and I was glad to see that in Korea you're going to stop using them, you're going to phase them out. Israel did the same. They had them in place for a few months. They did the job, and then they took the passports away again. It seems like other parts of the world are going to keep them in place for much longer, and I'm not sure that's necessarily a good thing.
Yeah, we just heard the UK is thinking about doing away with the vaccine passes as well. It doesn't help when you have world leaders like President Macron in France saying he wants to make it incredibly hard for people to go about their regular life without these vaccine passes either. It just riles people up. But since this pandemic began, life has been turned upside down for all of us, but especially so for kids. Now, I know this isn't entirely your specialty, but you're still a professor in the medical field. Are you concerned with the face masks, the limited social interactions, the lack of playtime, all these kind of things, a mixture of it all is going to have a negative impact on not only the behavior, but also the cognitive and emotional development of kids? And it may not be something that appears right away, but something that happens in a few years' time.
No, of course I am. Actually, I'm not a particular expert on this, but my sister is a primary school teacher in Hong Kong, and she's told me that there's a lot of evidence of this happening in the children that are coming into primary schools now. They can't do things that children would normally be able to do at that age, whether it's writing their name or not needing a nappy if they're a bit younger, you know, that kind of thing. So I'm sure that there's been a lot of impact. Now, of course, some of those measures were necessary for public health reasons, because COVID is a major public health threat. But I think we're all looking forward to the days when COVID is much less of a threat and we won't need any of these public health measures anymore. And hopefully we can make up for the lost time, especially with the younger children.
And Professor, especially now that Omicron is known to be more transmissible, there seems to be a notion that everyone would eventually catch Omicron, regardless of the preventative measures. What is now 3 years? It's going to be 3 years now. So, do you also sense this pandemic fatigue? And what would you say to people who feel that way?
Well, of course, there's a lot of pandemic fatigue. This is now the third year of the pandemic. I'm sure that you're going to get COVID at some point. I'm sure that I'll get COVID at some point. I'd rather it's later than sooner. It's going to happen sooner or later, but I'd rather that it's later. I think from the government's point of view, they know that people are going to get infected in the coming months, in the coming years, but they'd rather that each of us gets infected every 5 years or every 10 years or every 20 years rather than every year, because the more people get infected every year, that means the small proportion that get hospitalized is going to be a bigger number and cause more problem for the healthcare systems. So I think it's still important that we look for ways to protect ourselves. The government's still going to be on the lookout for ways to keep levels of infection relatively lower. But at the same time, I don't think we're going to see such drastic interventions in 2022 in Korea and in other parts of the world as we've seen earlier in the pandemic, because I think with vaccines, with antiviral drugs, as you mentioned, with the level of immunity that's been building up in the population, I think COVID poses less and less of a threat.
Now, finally, I wanted to touch upon something topical, because the IOC recently said that it's not going to be selling spectator tickets for the Beijing Winter Olympics to the public. They're only going to be for a very select number of people. A, do you think this is the right move? And also in regards to China, despite claiming they have a handle on this virus, they sure seem to be pretty anxious, pretty jittery. Do you think that the Chinese government are really covering up what is the real scale of the problem with this pandemic in China?
Well, of course, in mainland China, they're still following the zero COVID policy. That means they don't want any infections. If there's an outbreak in a city, recently we heard about Xi'an and then Tianjin and also a few other places. Whenever there's an outbreak, it's very, very disruptive for that city. They have to do a total lockdown, test everybody multiple times. I'm sure it has an enormous social and economic impact. So the less frequently they have to do this, the better. And in Beijing, I'm sure they're being very, very, very careful right now about the risk of Omicron. If it gets into Beijing, that would need a shutdown of the city, a lot of testing, and they want to minimize the chance that happens. So I understand why they've got this new policy of no visitors at the Olympics, no spectators at the Olympics, at least from the general public. I'm sure there will be people spectating. In terms of the scale of the problem, I think we can track the incidence of COVID in China, not only with the case numbers, but also with the lockdowns. We hear this particular city is having a lockdown and everybody's getting tested. That tells us already that there's going to be some cases in that city. And we can also check the daily case counts. So I don't think there's a lot of infections in China that we're unaware of, because they're so careful every time there's an outbreak to crack down on it really, really quickly.
All right, Professor Cowling, thank you so much for your insights as always.
Thank you.
Thank you.